Efoks tablets, antianginal drug, reduces myocardial oxygen demand by reducing preload and afterload, increases exercise tolerance in patients with coronary artery disease, angina pectoris, expands the vessels of the brain, durometry, which may be accompanied by headache. The antianginal effect occurs 30 to 45 minutes after ingestion and lasts up to 8 to 10 hours. Indications: prevention of angina attacks in patients with coronary artery disease includes after myocardial infarction, chronic heart failure as part of combination therapy. How to take course of administration and dosage. The dose of the drug and the frequency of administration are set individually depending on the severity of the disease. It is advisable to start therapy with small doses of the drug, 10 mg 2 times per day, then gradually increase the dose to therapeutic, 20 to 40 mg in 1 to 2 doses. If necessary, the dose is increased to 60 mg per day. The maximum daily dose is 80 mg. The duration of treatment and repeated courses on the recommendation of a doctor. Tablets should be taken orally, after meals, swallowed whole, without chewing and with a small amount of liquid. Contraindications: hypersensitivity to the drug, organic nitrates, acute circulatory disorders, shock, vascular collapse, cardiogenic shock, severe arterial hypertension, hypovolemia. Simultaneous administration of phosphodiesterase inhibitors includes sildenafil, vardenafil, tadalafil. Acute myocardial infarction with severe arterial hypertension. Anemia, severe form. Hereditary galactose intolerance, lactase deficiency of malabsorption syndrome of glucose and galactose. Toxic pulmonary edema, lactation period. Children and adolescents up to 80 years of age. Special instructions: Efoks 20 is not used to relieve acute attacks of angina pectoris and acute myocardial infarction. With prolonged use of Efoks 20, tolerance may develop, and therefore it is recommended that after 3 to 6 weeks of regular use of the drug, take a break for 3 to 5 days, replacing Efoks 20 with other antianginal drugs. With the development of intolerant symptoms, reappointment of the drug is not allowed. During the treatment period, it is not recommended to drive vehicles and engage in other potentially hazardous activities that require quick psychomotor reactions. Side effects: from the side of cardiovascular system, at the beginning of treatment, a headache. Nitrate headache may occur, which usually decreases after a few days of therapy. Dizziness, flushing of the skin of the face, feeling of head, tachycardia. On the part of the digestive system, nausea, vomiting. There may be a slight burning sensation of the tongue, dry mouth. From the side of the central nervous system, stiffness, drowsiness, blurred vision, decreased ability to quick mental and motor reactions, especially at the beginning of treatment. Rarely, cerebral ischemia. Allergic reactions, skin rash,